Hi, I'm Dr. Mark Schusterman. I'd like to talk to you today about breast augmentation, one of the more common procedures patients ask for. It has a high rate of satisfaction and is very safe. What are the indications for breast augmentation? Obviously, patients that have small breasts in proportion to the rest of their body are good candidates for this procedure. Women who have had children and their breasts are somewhat deflated are good candidates for this procedure. There are several choices you have in determining what type of breast augmentation to have. The first one is the incision. There are three basic incisions that doctors use. One is under the breast, the other is around the nipple, and the other is through the underarm. I prefer to go under the breast because I believe it's the safest, most natural way to do the procedure and gives the best results. When I close the incision, it heals very well, and after a certain amount of months, I can barely find it. So I encourage you to consider that. The other thing that you need to choose or think about is whether to put the implant under the breast or under the muscle. The pectoralis muscle is under the breast. You can either put the implant on top of this muscle under the breast or below the muscle. I prefer to put the implant under the muscle. I think it looks more natural and is a safer way to perform the procedure. The other thing that we need to talk about is what type of implant to use. There are several different types of implants. There's saline-filled, gel-filled, textured implants, and smooth implants. There's anatomic shaped implants and round implants. In the majority of patients, I prefer to use round, smooth, gel-filled implants. I think they're safe, I think they give the best result, they feel natural, and they look natural. Let's talk also about how the process with your consultation goes. The consultation, obviously, you'll come in and first we'll meet and chat about what your goals are and what how you want to look after your procedure. We'll then go into the exam room, do our exam, take our measurements, and also get some medical photographs, including 3D imaging. The 3D imaging is very helpful in helping us choose what size implant to get. The size implant that most patients want is to look as natural as possible. Too large and you obviously won't look natural, and people will know that it's obvious that you've had a breast augmentation. Too small and nobody will notice anything different, and I think you'll be disappointed. So the perfect size is where people look at you and say, something's different. You look really good, but I can't figure out what it is. That's the perfect size we want to have for you, and that's how we'll go through the sizing procedure to make sure that you get the implant that you want. Once we get the medical photographs, we'll go back into the consult room, and again, we'll go through the 3D imaging, which will actually show you what you look like with your implants in place. Once we've done that and you've decided which size implants to get, we'll plan your surgery. The surgery is performed at a small outpatient procedure hospital. It's an outpatient procedure where you'll come in the morning, you'll have the procedure and go home that afternoon. I will see you several days after the procedure to make sure everything's okay and start you on the massage of the implant, which you probably already know about or you've heard about. After that, I'll see you at 1 month, 3 months, and 6 months. I hope you've enjoyed this video on breast augmentation. I look forward to meeting you and answering more of your questions in my office.